On to this week's class, When Your Health Matters, the class designed to empower you to better health through knowledge and education. I'm your host, Dr. Richard Untoon from Advanced Alternative Medicine Center. We are located at 138 Canal Street in Pooler Park. That is in Pooler, Georgia. We're in Suite 404 of Building 400. If you'd like to get a hold of me, stopping into the office is always a good idea. Get to meet me, ask your questions directly to me, probably get a brief evaluation due to my own curiosity to understand what's going on with you and offer you the best advice possible. But people still being a little reticent to meet strangers, probably be better if you called me directly ahead of time. You can call me directly on my cell phone, area code 845-561-2225. Again, 845-561-2225. Please do not text that phone, as that phone is not equipped to receive texts. I will never receive it. I will never respond. You will get upset. That defeats the purpose of you trying to reach out to me, but you can always leave a message on my cell phone. Or you can email me directly at docrick, DOCRICK, at spineboy.com, docrick@spineboy.com. And it would be my pleasure to help you to better understanding what the concerns you have regarding your health. This weekly class is done in an effort to help you better take control of your health. This particular class is going to be a completely different format. I'm actually going to survey you because the class is simply about responding to people's surveys. And if you were sitting in my office, I would have you fill out the survey and then we would go over the survey with you. So we're going to do the same kind of thing here, which requires me to actually read some things to you. It's not my intention not to look at you the whole time, but I'm going to read the questions and you can answer for yourself how many of these you have, how many you have experienced, and whether you would like some help with understanding all of that. Please appreciate, being healthy is your birthright. You are intended to be healthy your whole life. Anytime you have a symptom, that's an indication that you've lost greater than 60% of normal functioning. And that's pretty far down the rabbit hole before you would even consider doing something about it. And taking prescription medications that end up being lifetime prescription medications simply mask your symptoms, make you unaware of the fact that you have the problem, never addresses the problem. And when you ask the professionals about, well, what do you think is causing my problem? Why do I have high blood pressure? Or why do I have diabetes or autoimmune disease or heart disease or cancer or any number of different health conditions that people have? The doctors basically say, well, we just don't know. We just don't understand. And that isn't a very good answer. And it certainly doesn't increase the confidence in the person who you're supposed to be serving as a healthcare provider. So for those who are you that are in the trenches doing the work and helping people, thank you very much for being a brother or sister in this healthcare industry. But if you are just simply writing prescriptions and setting people up for lifetime medications and life-altering surgeries and changing the way that the person actually experiences health or never to experience health ever again, that's disappointing. And I would hope at some point you could wake up and change your perspective and change your focus. So the first question about this, how many of you in the past 6 months have experienced any of the following? Allergies, fatigue, being tired, having low energy, some level of fever, dark circles under the eyes, sinus congestion, chronic cough, craving sweets, resulting in binge eating, developing a runny nose, swelling anywhere in your body, bloating after meals, indigestion, gas after meals, excess belly, hip, or thigh fat, experience colds, has had the flu, perhaps even had COVID, indigestion or heartburn, cold sores, fever blisters, excess mucus in your chest, postnasal drip, constipation, arthritis, diarrhea, weight management issues, has a sense that you're always cold, experiencing cold hands or feet, trouble sleeping. 70 million Americans have trouble sleeping. So, how many of the following emotions do you experience regularly? A sense of worry, yearning, having a lack of control over events, confusion, feeling despair, some level of nervousness or anxiety, cloudy thinking, obsession, or low self-esteem. Low self-esteem is the gateway to becoming addicted to sugar. Third topic, how much do you do the following? You drink how many ounces of water a day? FYI, you need, how much do you need? Time out a second, my brain just went blank. Probably need more water. Okay, you need 1 quart of water for every 50 pounds you weigh every day. So if you weigh 100 pounds, there's your requisite 8-ounce glasses of water. But if you weigh more than 100 pounds, you're going to need more than 8-ounce glasses. If you're 150 pounds, you need 3/4 of a gallon. If you weigh 200 pounds, you need a whole gallon of water every day. You'll need more if you're exercising, whether it's aerobic, where you'll need another quart for every half hour of aerobics, or you'll need another quart for every hour of anaerobics, meaning lifting weights or similar type activities. I eat processed foods how many times a day or how many times a week? I smoke how many cigarettes a day? I eat home-cooked meals how many times a week? 2, 4, 6, 8, 10, 12, 13. I probably eat 13 or 14 home-cooked meals a week. I eat organic food how many times a week? I sleep how many hours a night? I personally get at least 7.5 hours of sleep every night. I drink how many cups of coffee in a day? I drink alcohol how many times a week? And I relax how many hours a day? These are good things to understand. Now, last but not least, do you currently suffer with high blood pressure, high cholesterol, headaches, mood swings, loss of patience with yourself, your job, your spouse, your children, have libido concerns, just have no interest in being intimate with your spouse or partner or anybody else you happen to be intimate with. Experience hormonal imbalances. Are you taking artificial hormones? Do you have erectile dysfunction? Do you have hot flashes? Are you having menopausal issues if you're a woman? Does anybody out there have any indication of heart disease? It's still the #1 cause of death in this country. So chances are you could have heart disease and you don't even know it, because the first symptom of heart disease is a life-ending heart attack. Tough way to find out. I guess it's not a bad way to go out. Tough situation a lot of people have. I know lots of people who have experienced this. The condition of cancer. I would like for you to understand that if you've ever had cancer, have cancer, or being told that you may have cancer and they're running tests for cancer, I promise you, you have a parasite. You have a parasite in the organ or gland where you're being impacted with the diagnosis of cancer. And until you address the parasite, they're going to make lots of money off of you doing treatment for cancer, and there's a certain percentage of you that aren't going to survive. And that's disheartening for the world. It's disheartening for your loved ones. Appreciate that the world is not the world without you in it. So we'd like for you to stay. We'd like for you to be healthy. That's my personal wish for all of you. Do you currently take any prescription medications? If you are, I'd like to help you with that. Do you currently take any vitamin supplements? If you are, good for you. If they're not real vitamin supplements, then I'd like to talk to you about that and help you switch from the over-the-counter vitamin supplements that you can get at any of those box stores that sell supplements to understanding what true whole food supplements are versus the chemical synthetics that are made by the same pharmaceutical agents that they make pharmaceuticals with. Most important question, do you want to get rid of your health concerns? My hope is that yes, you do. Having a health concern should not be a life sentence. Please don't allow it to become a life sentence. And last but not least, would you like my help with any of your health issues? Your answer could be no. You may already see a healthcare provider. I had a woman this morning call me and left a message, and when I called her back, she's like, that's okay. I've already made another appointment with a different provider. That's fine. My hope is that whoever is helping you is actually helping you, not making a lifetime of income off of you. I've dealt with lots of beautiful healers in the world where my time with them actually came to an end. Why? Because the work that they promised to do for me had finished. My hope is that if you become a patient of mine, that the time will come where your active symptoms are no longer symptoms. And we can change our relationship to a health maintenance relationship, to where I see you maybe once a month or once a quarter or twice a year or whatever would be comfortable for you. Something to consider. Take the time to go back through this video and answer any of the questions, the indicators, the symptoms, etc. that you said yes to. Please get a hold of me. You can send me an email with the response to this particular video at docrick, D-O-C-R-I-C-K, at spinewood.com. You can call me directly at area code 845-561-2225, and we can discuss your survey results. Or you can write all the answers down and bring me the survey, and we can have a sit down and discuss all the reasons for why you have what you have and what are the solutions to addressing them fully. So I want to thank you for studying through this survey class. I would ask you to tune back in next week, same health time, same health station. This is Dr. Richard Untoon from Advanced Alternative Medicine Center, located at 138 Canal Street in Pooler Park. That is in Pooler, Georgia, Suite 404 of Building 400. And I would look forward to at least you watching a video next week. Thanks again. Have a great day.